Hi, I'm going to be your student nurse today. My name's Cameron. Can you tell me your name and date of birth?
Taylor Hicks, December 3rd, 1999.
I see your bracelet. Okay, awesome. I'm going to be doing a cardiac assessment on you today. So I'm first just going to ask if you had any chest pain or noticed any problems with your heart. Okay, so first I'm just going to inspect. Your color seems good and pink. I don't see any cyanosis or pallor. Have you had any issues breathing? I don't see any issues with breathing. I don't see any accessory muscle use or anything like that. Could you put your hands out like this? The test capillary refill. Good, under 3 seconds. And if you could just put your thumbs like this. Okay, and no clubbing. Now I'm just going to inspect your precordium for any pulsations, lifts, or heaves. I don't see any, but if I were, then I would palpate the precordium. Just any bulges or masses. Is there any tenderness when I do that? I don't feel anything abnormal. So now I'm just going to palpate the carotid arteries one at a time. Okay. Rate and rhythm are good. They seem symmetrical. I would describe those as a 2 on the 4-point scale. Now I'm going to auscultate the carotid arteries using a bell. If you could hold your breath for me. You can breathe out and hold your breath again. Those sound normal. I don't hear any bruits. So I'm just going to auscultate the heart for rate, rhythm, and intensity, starting with the aortic valve, which is the second intercostal space, right sternal border, and the pulmonic valve, which is also the second intercostal space, but left sternal border. And I'm using the bell for this as well. And then Erb's point is the third intercostal space, left sternal border. And then the tricuspid valve is the fourth intercostal space, lower left sternal border. And the mitral valve, which is the fifth intercostal space, lower midclavicular line on the left. All those sound good. I don't hear any adventitious sounds. I don't hear any rubbing or any S3 or S4 sounds. I heard the S1 sounds the best at the tricuspid and mitral locations near the apex of the heart, and S2 sounds better at the aortic and pulmonic valve sections near the base of the heart. If I were to have heard any murmurs, it would have sounded like a swooshing sound, and I would have put her on her left lateral side and listened for the location, the intensity, and characteristics of the murmur, and then sent her down for an echocardiogram. And that would be the end of the cardiac